Okay. Nope. I'll turn off. Life of virtual.
All right, can everyone hear me? Wonderful. Well, I am really happy to be here this evening. Thank you all for inviting me out to talk to this group. The work that you do is vital. And what I wanted to do is just give you all a brief overview of just the history of lead in the county and kind of the roles of the different players, including yourself, in how we get at this problem. You all have covered some of that just from the beginning of this meeting, but wanted to give you a better sense of where we are at the Shelby County Health Department and who we have been trying to collaborate to assist not only in your work, but just assist in the work that other folks are doing in the county around this issue. Okay, so I hate to watch myself talk on camera, so I'm going to turn off my camera, but when we get to Q&A, I promise to turn it back on. And I'm going to try not to show my age and get this to work the right way. If I can get it to move. Let's try this again. There we go. So a little history of lead in Shelby County. So actually the Childhood Lead Poisoning Prevention Program was created at the Health Department in 1994. And initially it just targeted screening in high-risk communities. And those communities were identified by the City of Memphis Housing and Community Development Division. And they used things like what we use even now, the age of the housing stock, the median household income per household, and the total number of people in the household to determine who needed to be tested. And I can tell you that I remember this because this was when I was getting mentored by Dr. William Terrell right over there on East Shelby Drive. And one of the things that we did a lot of was lead testing for high-risk individuals that were coming in to see the pediatrician. By 1995, reporting blood lead levels was required by the CDC, which was a major development because it was an acknowledgement that we had had a problem for a while, like you were talking about. And then in 1999, 99% of all the lead reporting in Tennessee was coming out of Shelby County. So that just gives you a sense of what we were seeing even then. And by 2000, the Childhood Lead Poisoning Prevention Program, probably as a result of what we were seeing coming out of Shelby County, transitioned from targeted screening to universal screening. So there are two main Shelby County lead initiatives in this county. One is at the Shelby County Health Department, and you all know that one well, the Childhood Lead Poisoning Prevention Program. The other one is the Mayor's Administration, and that's you all, the Shelby County Lead Prevention and Sustainability Commission. And our mission at the Shelby County Health Department in our lead poisoning prevention program is to prevent and reduce the harmful effects of lead poisoning among Shelby County's children under the age of 6 and other high-risk children, because we know that if we can catch them before 6, then a lot of the harmful effects that could happen, we can catch it, hopefully not have them get to the point of chelation and get treated and be okay. Our program's purpose is to not only increase awareness of the hazards of lead, but reduce lead exposure, to report and do surveillance, increase the number of children who are screened and tested for lead poisoning. And we also link exposed children to recommended services. We work in collaboration with just about everybody that you see on that list, okay, in some form or fashion. Now, I know that this group is really savvy, so you know the way we work with them depends on the funding source and who's charged with what, and Tennessee code and Shelby County ordinance and city law, and all of those things come together to try to get at this problem. but it can be very complicated. And I know you all know that. And so we get to you all. Your group was created in 2019 in response to Tennessee Code Annotated Section 49-2-133. I feel like I'm doing a military briefing when I have to do all of that, okay? And basically it required local boards of education to develop a policy to implement a program to reduce the potential sources of lead contamination in drinking water in public schools constructed on or before January 1st, 1998. Now, the way it depends on how you look at it, fortunately or unfortunately, we have a lot of schools here in Shelby County that were constructed before 1998. So the reason for you all being formed was really important because we knew that those schools were potentially a cause of lead exposure for a lot of our children in the county. The commission is comprised of 9 members currently, and these are all appointed by the Shelby County Mayor, all right? And you see those there. You all probably know this chapter and verse much more than I did before we prepared this presentation, right? But we also know that there are a couple of vacant positions, and hopefully those are going to get appointed soon, okay? So some of the things that you all do to support the boards of education in Shelby County: decrease the occurrences of elevated lead level exposure in public school drinking water, make legislative recommendations when necessary to support or amend statutory authority governing the reduction of lead in school drinking water in public schools, and then also liaise with the state's childhood lead poisoning prevention program, and finally, develop and provide public transparency regarding responses to lead cases in the public schools of Shelby County. Hey, how are you? So this next slide is pretty busy, but I'm glad that the team put this in. So I'll walk you through it. But it basically gives you a timeline of lead and childhood lead poisoning prevention, not only locally, but nationally, right? So up at the top, national starts at 1990, and it shows you how many times either the CDC or the EPA or a combination of the two decided that we needed to lower what an acceptable blood lead level was for children, right? So back in 1991, it was 10, right? And then by the time you fast forward through this and you get to 2012, they lowered it to 5, right? And then just last year, they lowered it to 3.5, all right? And you're gonna see a couple of more charts that kind of show you what that looks like in real time. And then locally, you'll see that we followed suit, did what we were supposed to do. We got funds at different points in time to make sure we were able to meet the goals that the feds had set. And that brings us to 2019 below, where this group was formed. So this next one is also busy, but what you're looking at here is seeing the percentages of kids in Shelby County that had what were considered elevated blood levels, okay? So the blue line at the top, if we had had an elevated blood level of 3.5 way back in 1994, that's what you're seeing, right? So we know that in 1994, the acceptable level was 10, but we wanted to show you what it would have looked like if the standard was 3.5 all the way back then, right? So the blue line is if the standard had been 3.5, and it follows all the way to 2022 on the right. The gray line is if the standard is 5, going from 1994 to 2022, and the orange line is if the standard is 10, right? So we know in 1994, the standard was 10. And at that point, 18% of our kids were showing that they had elevated blood levels with the standard being 10. If the standard had been 3.5, 77% of the kids that were screened had elevated blood levels, okay? So this chart tells you a lot. On the very left, you see some key historical events to go along with this. In 1973, the EPA realized just how much lead we had in our environment, and they said, we've got to get lead out of gasoline, because that's really what was causing the problem, right? Because of the exhaust from lead gasoline coming out of cars, he had lead everywhere. He had lead on the grass, he had lead in the air, he had lead in the, standing water, all of that. And so they realized that they needed to give us unleaded gas, which all of us have grown up having now, right? But in 1973, it was leaded. In 1978, the feds banned consumer use of lead-containing paint, right? But that doesn't help if your house was built before then and you were using all that lead paint, and then they like to paint the radiators, and then they would chip, and then everybody would go and eat the paint chip. The baby would go and eat the paint chips, right? 1991, the CDC lowered the elevated lead level to 10. And then in 1992, the EPA passed the Residential Lead-Based Paint Hazard Act. And then in 1994, the state of Tennessee began tracking lead testing, okay? So that's why our chart starts at 1994, because that's when our state started tracking it, all right? And then you have a couple of other historic markers that you see right above the graph. So this next one is a bar chart, all right? And I will try my best to make this make sense. It's easier than it looks, all right? So this is the number of children under the age of 6 screened for blood lead levels and elevated blood lead level rates, okay? So your blue line across those bars are elevated blood lead levels, and that is the rate, all right? So for example, if you look at 2022, in 2022, 13,348 children were screened, all right? That's just the number screened. And then 2.96% of those 13,000 plus children had elevated blood lead levels above 3.5. Okay? And what we did was, once again, that blue line shows if the standard has always been 3.5. So the good news is that if you look back at 2013, 17,000 kids were screened, 17,000 plus, right? But if we were using the 3.5 threshold at that point, almost 5% of the kids would have been considered having elevated blood lead levels. So that kind of gives us a lot of information about where we are and where we've come from as far as screening and how many kids in the county actually have elevated blood lead levels and exposures. Same type of thing on this graph, right? So the blue line, once again, is 3.5. The gray line is at 5, and the orange line is at 10, all right? And so it spans from 2013 to 2022, showing you those total elevated blood lead level rates for children under the age of 6 in Shelby County. So my team knows I like to show maps, so I needed to put a couple of maps in here. Let me tell you off top, the zip codes in the east are excluded because some of those zip codes spill over into Fayette County and other counties. And so it's hard for us to report an accurate number because we would include counties that don't include us because the zip code spills over into the next county, okay? So that's why you're seeing that exclusion. It doesn't mean that there isn't a lead issue here. That's why I was interested to hear you all talk about Collierville. It just means that it's harder to report, all right? It would take us longer to kind of parse out who actually lives in Shelby County and who doesn't. But as with all the maps that we show normally, the darker the color, the higher the rate, right? So on this map, you see 38118 is showing a high screening rate. So all of this is percentage of kids who were actually screened under the age of 5. You may wonder why it's not under the age of 6. It's because the way the census breaks out age is they break it out at 5. And so that's why we're reporting it this way in the map, okay? The lighter the color, the fewer kids that are getting screened in those zip codes, all right? So you can see in South Memphis, Whitehaven, and then 38118, you've got a higher rate of screening going on than in some of these other more eastern and more northern counties, zip codes. But there's still a lot of screening going on, okay? The next map shows you elevated blood lead level rates of children under 5 in the zip codes, okay? So the darkest color means that there was a rate of about 6.1 to 6.8% of the kids screened in that zip code were found to have elevated levels. And then the lighter the color it is, the lower the percentage of elevated levels. And once again, those eastern zip codes are excluded. Now, this looks like a lot, but this gives you kind of an overview of what it has looked like as far as screening from 2020 to 2022. And the reason I'm showing you this is kind of that COVID period, right? So to know what was really going on with screening, it's important to look at that block of time, especially when we were so consumed by COVID, all right? So I thought it was interesting when the team first showed me this. If you look at children who had 0 as their blood lead level, right? It says that 37 were screened, so they must have come up with some kind of risk factor. Somebody thought they had been exposed, they had 0, right? And so it's telling you if you have 0, there's no reason to do the confirmatory testing because there's no presence of lead and there's no other recommended action, all right? If you go down a couple of lines, go to the 3.5 to 9.9, right? You go to that line, right? Or let me do this first. Go to the 0 to 3.4, all right? So that means that you're not considered elevated. 35,000 kids got screened between 20 and 2022, and almost 97% of them were not considered elevated because they were below 3.5. And so what do you do if you're below 3.5 but above 0? The family gets education, and they're looking at the child's development and diet, calcium and iron intake. And I can tell you as a pediatrician, the reason you do that is, especially if you say, okay, it's below 3.5, but it's 3.4, right? I need to see if there are some nutritional deficits that are going on so that maybe we do a repeat test at some point, right? But technically, the technical definition is if it's below 3.5, they're good, right? Once you get to 3.5 to 9.9, we had 1,034 kids screened between 2020 and 2022. And that was almost 3% of the kids screened, right? That had that level. When you have that level, you have to do the confirmatory testing within 3 months. And then the test results do have to be reported to the health department. So even if we as the health department don't do the test, say a provider out in the community does the test, they are required by law to report those results to us. They're required they have to schedule a confirmatory test, and then an environmental investigation into the child's home occurs, all right? Going up, of course, you do more. 10 to 19.9, they have to have that confirmatory test within 1 month, right? But the nice news is, even one child exposed is bad. But the nice news is when you got into those upper levels, if you looked at 10 to 19.9 as a level, only 0.29, right? 0.29% were found to have that elevated of a level. They were to be screened within 1 month. And then everything that we talked about at the level before is what happens. And then, of course, if your level is above 20, you're more than likely going to the hospital, right? You're being assessed on whether you need chelation therapy, where they actually treat you intravenously to make sure that they get all the lead out of your system. You're testing the child to make sure they don't have any neurologic symptoms, any other physical symptoms from being lead exposed. and you just make sure that you're taking care of that child in every way possible. So this chart has a lot of information on it, but it's a good reference for this group, especially when you're advocating with the schools to say, listen, you know, if you've got a positive in this school, these are the things that, you know, are required by law that need to happen. All right. And the schools know this. So we get to schools and water testing. So water quality in Tennessee schools. In 2018, State Bill number 619, here I go doing all the numbers again, was passed and it amended the Tennessee Code annotated. All right. And this is all relative to water quality in schools. And this is really where you all's group grew out of in 2019 as well. All right. So it says that the schools are supposed to do biennial testing of lead levels in the drinking water at schools that were built before January 1st, 1998. And what happens is 250 milliliters of water are collected for testing after sitting in plumbing overnight. Right? And the schools know all of these regulations. They know what they're supposed to be doing. But you all are there to hold them accountable to. All right? So if the test results come back for the school, the lead level is 15 parts per billion, but is greater than 15, but less than 20. The annual testing is needed until retesting confirms level is less than 15. All right? So then at that point, the school says, okay, I got to test every year until we're less than 15. And hopefully we've found the source and they're remediating the issue as well. All right. If the lead level is greater than 20, they must immediately remove drinking water source from service. All right. So if you have kids in the public school system, they'll tell you, we can't drink out of any of the water fountains. They gave us, you know, bottled water, or they told us to, you know, bring water to school, whatever. All right. Then they are to notify the following agencies within 24 hours of getting that result. Commissioner of Environment and Conservation up in Nashville, Commissioner of Health up in Nashville, the local health department, us, the local governing body, and the Department of Education. All of those people are to be, agencies are to be notified within 24 hours, all right? And then within 5 business days, parents and guardians, right? The water source should be retested within 90 days of any corrective action. So basically, I've just taken you on kind of a really quick whirlwind tour of lead and lead prevention in Shelby County. You know, we know that elevated blood lead levels have significantly decreased from 1994 to 2022, but we also know that there's a lot more work to be done. And so I really do appreciate the opportunity to come before you all, give this presentation, and answer any questions that you have.
I just want to note that in 1991, the CDC did say that 10 was a level of concern, but it was not considered an action level. It was not considered elevated yet. So the elevated number was at 20 then. So they said it, and I think how they read it is, we acknowledge that that a 10 can prompt public health action, but they also said a 10 did not define a threshold for the harmful effects of lead.
Right.
So they did not even think 10 was very high then. I mean, so really these numbers could be much more exaggerated to see the kids that were 20 and under.
Right.
Compared to 3.5, because they didn't consider them elevated unless they were 20. That was just a level of concern. It was not their action level. And we fought for that to get down to 15 and then finally to 10.
All I like to say is that
One quick thing. So I do have to, I'll read my right quick.
Okay. Acknowledging on the record that we do have an additional LPC member that has arrived, Vice Chair Eric Stevenson, so we are now at quorum. Just wanted to say that. And then also, for the purposes of this presentation, questions will be limited to the LPC members. If there are questions from people from the general public, we can capture those and then follow up with Director Taylor and her staff, just FYI. Okay.
Numbers with it, even that higher gap of up to 20, because, you know, those are the kids that we weren't even saying were elevated back in the 90s when we were testing them. And, you know, we were saying, oh, you're fine. There may be a little concern, but you're not going to have any ill effect because you're only a 15. And compared to now, what we know, you know.
And the issue with being able to give you that information is if that level wasn't reportable at the time, we wouldn't even have that information.
You did get the, yeah, because we would get the blood lead levels because the nurses worked under me at that time.
Right.
At Shelby County, and so we still tested them and had the results, but then they were given to the state, but not
Right.
as an elevated.
Gotcha.
So, but it's, I mean, as bad as this looks, it's even worse, really. Because we couldn't consider them an elevated child to give priority to the house.
Mhm.
It's really scary.
So I
Thank
did
you.
have a question. So for my advocacy seat, and I'm just gonna be transparent. So with these appointments that I have right now, I don't think that will ever happen again. So from a resource perspective, the first thing that I thought about when I was looking at the slide where it showed like the dip in the number of kids screened. So like in 2016, it looked like it was the highest within that span. And the first thing I thought about was probably public fear around the crisis, around the Flint water crisis, is what I think may have like prompted people to want to get their children screened more. That's just an inference. But what can we do from an advocacy perspective to help to increase the amount of kids that's actually being screened? Because my inherent fear is like, there could potentially still be so many children that have not been screened and could potentially be poisoned, but are not like kind of invisible, are not really showing up in the numbers. I know that's been a consistent concern, especially since COVID. So I know just in the spirit of transparency, we went to county commission before and said, can y'all give the health department some more money so that we can try, because it takes more than just like what one team of people can do, right? So we even talked about like, can we get in the inserts with MLGW? Can you get that to the ratepayers? Like, what can we do, like as a collective, to really encourage parents to get their kids screened? Because that's in my gut. Because I'm like, I know that there's some more children that's out there, and because in my former life, I used to work for the district and used to be in the classroom. I'm like, I feel like there's more. But like, what can we do from this body to try to advocate for more resources so that we can try to get more people or get more children screened?
Well, it sounds like you've already started that process, right? But my question for you would be, are we talking about just kids under 6? Or are you talking about kids over 6, right? Because, you know, when we talk about what the law says, hey, you know, universal screening for kids under 6. And the only time you're going to get screened over that is if you have risk factors, if we know you're living in a house that was constructed before then. Or, you know, you all were talking about lead service lines earlier. If you know the child is living in a house that's being serviced by a lead service line, that takes a lot of work to kind of bring all of that data together, but it's not impossible, right? And so it sounds like you all are taking some of the steps necessary already to advocate for that, but that would be my question back to you, because it's hard to figure out how many resources you would actually need, because you got to define who you're actually trying to reach, right? Right now, it's well defined. We know that universal screening for 6 and under is supposed to be happening. We know that, right? But do we need to be looking at data in a different way to see if, you know, we need to be testing another population a little bit more? It's probably not a complete answer, but that's the best answer I can give you.
That's an excellent response. And you made me think about, it was that one little window of time in 2019 when those lead testing results came back. And Mayor Harris was just like, hey, we want to, no matter who it is, no matter if it's K through 12, get them screened if they attend a school that actually had the elevated levels. But the caveat there is the levels with that law are still high for the point of remediation. So it still can be some kids that fall within the cracks. But I think we've discussed before, like things that require like a legislative change, which that's a good start. We're one of like very few states that even have a requirement around testing for lead in school drinking water. But that's a good point around like what the law requires with the 6 and under versus like any child.
And then the other thing to remember is when you're going to the state to have this type of advocacy, I was going to show you this other slide, but I don't know if it's going to cooperate with me. When you're going to the state, remember, and this is an extra slide we have in here, right now we have 228,074 children under the age of 18 living in Shelby County. Right now. 228,074. And about 73,895 are under the age of 6. And so that equates to about 32% of the total kid population under the age of 18.
And of those 73,895 kids, how many screenings have we gotten? What's the number of kids?
Let me see if we have that. I think it's on here, but don't quote me. That's a great question. So in 2022, 13,348 were screened is what we have.
There's still a huge gap.
Right.
I think that we're doing great to go into like.
But remember, we're only screening at certain ages.
Yeah.
And so that's why it doesn't, the numbers don't match.
Gotcha.
Because they may have been screened at different time points between, 2022 and then count 6 years back.
Right.
Still use
So
the
think
same
about
zip
that.
codes
You have
that you used last, the same zip code.
Same zip codes, all of that. Yes.
Yeah, I'm just thinking there should still be 73,895 kids at a certain age. Well, yeah.
Well, now she's saying that
Under
this
6.
number is like an aggregate, depending on like when.
Where they are.
Right, so it would fluctuate. It would be based on like how many children were like born.
Yeah, all at this time period, right?
And then like how, it's like, I get what you're saying. There's a lot of different conditions.
Yeah, there's a lot of conditions.
But
So
then,
when you go to the state, I always, whenever people ask me that specific question, and I love that question, when you go to the state, or even when you go to the county commission, you've got to figure in and tell them, this is how many kids we're potentially talking about. This is the price tag for this, right? Or what we think the price tag will be, so that they don't undercut you, especially at the state level, on resources, right? Because Shelby County is the most populous county in the state. And so whenever we go to say, hey, state, we need more resources for this, we need to tell them chapter and verse how many people we're really talking about when we're talking about doing this type of screening or any kind of screening.
And then y'all have nurses right now under CLEF, or how many nurses are you have now testing kids?
I'm gonna defer to.
It's one.
Yes. No, so we have to, if we have any ramp up in testing, we have to figure out where we're gonna get resources from other places to be, right. So that's why I say, any advocacy you do, think about how many resources we have now and how many resources we would actually need.
It's just one now?
Well, it's been one for a while, actually, since I think.
Okay. I didn't mean to belabor that, it just is.
That's okay.
My spirit. Okay.
But, I mean, I applaud y'all for doing a lot more outreach events again, going out to quarter days and testing those kids. I think that's really strong.
Yeah, Dr. Barnes will show up anywhere where there are little people. Yeah. I guess, and I don't want to consume this, I guess like my other question is, so while I think that there is, I'm trying to figure out how to frame this. So there is a lot of focus, like from a residential perspective, from lead paint.
Mhm.
But of course, like even when we heard from public comment today, with this body, we even amended like our bylaws to be more inclusive of not just like lead paint, but any potential exposure to lead. One of those things being water, where you're gonna touch water everywhere, at school, at home. We have this law that's holding like the schools accountable, but then it's kind of like a free for all, like in other spaces. So I'm wondering, like from a health department perspective, how can we partner in that? So for example, like it's so much like focus on the lead paint side, and I'll just be frank, I don't think that MLGW is being held accountable like everybody else. So you got the school system that's being held accountable, right, for both lead paint and now for water. You have the health department that's responsible for a litany of things, right? But honestly, like MLGW kind of just goes like under the radar, but I still think that they have like some responsibility, and we're having a tough time to get them to kind of see that, because the regulatory side is also like weak on that side. But just from your perspective, like also from an advocacy perspective, like how can we push like MLGW to do the right thing?
So I'm going to bring up something that you said earlier. So we all know that we have city government and we have county government. And so, I mean, anybody from the public can go before city council and advocate. I mean, those meetings are public, just like the county commission meetings are public. So it really is a matter of figuring out, in my opinion, if there is a group comparable to yours on the city side. And then whether there is or isn't, just find out what it looks like on the city side, because they are responsible for MLGW. We all watch the news. We know that City of Memphis is responsible for MLGW. And so from a health department perspective, there's very little that we can do in that regard. We can ask, we can advocate as well based on the data that we have. But we still know where the responsibility lies on that side. Like, let me ask you a question.
Send it to me. Okay, you can tell me now. I'm just gonna be real. We have a new mayor that is about to be inaugurated soon.
Sure.
To be transparent with this body, this was modeled after the commission in the state of Maryland.
Okay.
So when now Mayor Harris, prior to he was senator, state senator, when we were looking from afar, I still was in DC, and I was like, oh, somebody from Shelby County got this bill passed. That's a big deal. Because at that time, I think like only 8 states had a bill like that. So we were able to get in there quickly and advocate and say, hey, this bill is great. We need some oversight. Like, pretty much, can you establish a commission? And so they went back to their legislative folks, and then the resolution got passed. I was surprised, praise God. Since we're about to shift into new leadership, and I'm going to echo like something that you said, and then something that we heard in public comment, is we need something similar on the city side. I'm gonna be honest, it's tough, like saying county to go before the city, and they immediately shut you down because they're like, oh, you're on the county side. If we were to propose something on the city side that mirrors like what we have on the county side, with the health department like helping, like pushing gingerly and positively for something to exist similarly on the city side. Because honestly, when we initially talked about this commission, at first we pitched it to be city and county.
Right.
But then they were like, it's gonna get caught up on the city side. We have more control on the county side. If we wanted to actually pass, let's just make it county.
Right.
But there might be promise with new leadership, specifically with Mayor-elect Young. I mean, he worked on the housing side, on the community side. He's a lead person, but And you don't have to tell me now, but just pitching that with like, even though you're on the county, it's county, but to have that backing, like of the health department saying, hey, from a public health perspective, you know, we can see like what happens like on the county side, because we've been able to do a lot, especially with having somebody from the health department on this body. Is that something that the health department could do? It's just asking, but nicely. I don't know how that works.
Right, so I'm not gonna say no.
Okay.
I'm going to say you have to let me find out. And this is why. Because I do have to tread lightly.
Yeah.
Because I'm on the county side. Now, years ago, see, I know it. So years ago, we were a line item in the city budget. And so that did give us a bit more wiggle room when it comes to advocating on the city side. Doesn't mean that we don't partner. Like, you look at these slides more closely, we do partner with some city agencies and, you know, departments and all of that. But when it comes to really like pushing for ordinances, laws, that kind of thing, I have to ask permission, right? I serve at the pleasure of the mayor. So any day he could say, Dr. Taylor, your services are no longer needed, right? So I'm just telling you that I have to be very careful with saying, I'm just gonna march over to City Hall and tell them what I think they should do, because it doesn't work like that. But I hear what you're saying. So if I was given permission from my bosses to at least go and give a presentation, just like I gave to you all, I'm more than happy to do that. But I would have to get permission.
Okay.
Right? And you all may get a lot of questions from the mayor and his administration about, okay, what exactly are you trying to do? What is Dr. Taylor going to be talking about? What is she going to have to say? You know, is she going to have to defend certain points that maybe the county doesn't? You see what I'm saying? So I have to get permission, right?
Can I make a statement? So you made a statement that there was no organization that was dealing with the city. Memphis Shelby County Legislative Collaborative has been working with the city with light, gas, and water for almost 15 years.
Right.
Now, how successful we've been is questionable. We've done some. But I just want to get that out. There is a nonprofit organization that's been working with light, gas, and water that are citizens,
Right.
Memphis citizens.
Yeah, but for I'm all about like accountability is what I'm trying to get to. So like on the county side, like there has never been an instance like where we've asked for something and like somebody just straight up told us no on the county side. Literally anything that we've ever asked for with this body on the county side, we've had it. But on the city side, it's like block after block after block, where there have been instances where they'll shut me down completely and say go back over to the county. But
And that's why we had to go with EPA. We had to get EPA here twice to do a preemptive inquiry. So,
okay.
I mean, we tried to do it the right way.
Okay. Well, I know you stay over time,
Okay,
Director Taylor.
no,
This
it's
has been
okay.
amazing. Also, one quick thing, when you mentioned that like school level people, I think the district knows this information that you gave today, but school level people,
Do not.
they do not.
That was my question. How can we talk to on the health side with the school on these elevated children to encourage them to take more action towards IEPs, for things they need when we have these really high elevated children? Because right now, it's up to the parent to tell the school to ask, to advocate for the kids, and there's nobody on the health side to really advocate for these babies that are elevated.
Well, that's where you all come in with the liaison work that you do.
Yeah.
As you develop the proposal, think about dropping that in there.
Yeah, we would have to do a recommendation to an amendment to the local policy with the board. And sometimes they're a little bit reluctant to go above what the state is asking to do,
Right.
but you know, we can circle back to that though. But that was my concern today. Well, I want to honor Director Taylor's time.
Thank you all so much. No, I really appreciate you all having me. Let us know how else we can be helpful. And I look forward to seeing all of you all again.
And no, Director Taylor, we are partners in this work.
Absolutely.
We want to do what we need to do to get this lead out of the city.
Yes.
So please know that we are in collaboration to push forward the agenda to get the lead out.
Well, we're going to do it together.
Yes, ma'am.
All right, y'all.
Thank you.
So I am going to mute. So you're going to have to unmute.
Okay, and I think we're good. Okay. All right. So because we're a quorum and we might shift, I do want to go back to agenda item 3 for the approval of the minutes since we do not have quorum. So if we can just,
Move to accept.
do we have a second? All right, so we approve the minutes from the October 18th, 2023 meeting. All right, so let's go into old business quickly. Thank you. All right, just on the record, we are now not at quorum. So go ahead. We're not at quorum, so everything will be a point of discussion. So we won't be able to vote on anything, which I don't think that we have anything on the agenda that warrants a vote. It's just largely discussion. All right. So first, thank you. Thank you. So first agenda item under all business is revisiting the county commission request for the pollution reduction plan. So for the scope of this commission, we would have to focus, well, technically we can focus on water and on housing. Forget about that. I just put water quality. It could be housing too. Point of discussion, we made some recommendations that were more so like heavy on the regulatory side. But I think, especially like listening to Director Taylor, I think the only thing that they would be able to provide regulatory insight on would be from the groundwater perspective, right? They can't do any, they don't have any power on the city side. On the record, I'm just gonna keep hope alive that our new mayor-elect on the city side will do the right thing and have a mirrored board or commission on this, because otherwise there's no oversight, because the MLGW board, they could if they wanted to, but they don't. But I mean,
just for, I guess, the thought exercise, what could, or what do you see the MLGW board doing? Creating a internal group, or what's your idea?
it really needs to be both, but the big emphasis is on external. So essentially what I would envision is what we have, but on the city side. So for example, like even through public comment where they told me, where Chet reported like they're not doing the right thing, where they weatherize with the windows, all I can do for mine is just say, hey, we had a complaint with public comment. They can determine whether or not they want to respond to us or not. There hasn't been an instance like where they did not respond, especially, I mean, from the politics of it, because we have our county attorney on there. It's an interesting relationship between the city and the county, and with MLGW, um, where it looks bad, where on my county email, if you're not going to respond to something and you know you're wrong and you don't do it, then you have legalities, right? With that, even if it is on the county side. But the ask would be for it to be both internal and external. So like some sort of internal control where you have some type of system where you're assessing like, who are the polluters? How are they polluting? How do we minimize and reduce that pollution? And then the other part is public transparency. So if you do have this internal like locus of control where you have like your regulatory body from a local level, then it still needs to be some type of community like liaising. So the community has some sort of oversight, like, are you doing what you're supposed to do? So for example, like with Shelby County Schools, They're doing what they're supposed to do. Have they got better over time? Yes. So if you look at how they did stuff in 2019, where it was like no public transparency, it was a mess, versus now has gotten a lot better because you have an entity like, I'm watching you, like making sure that you do this right, but then also providing like some insight. With MLGW, it's nothing like that. They literally do whatever they want to do. But that was insightful. It's really not a whole lot they can do like on the county side, but I don't know. But there are still some things that like on the county side that they can do, that are not necessarily like within our warehouse. Um, the only thing that I can think of outside of like groundwater would more so be like on county collateral, and that would be like on the infrastructure side. So for all buildings that are owned by the county, like making sure that like even if it's beyond like a school building, but if it's like a public space that like it doesn't have lead in it, so that there's no lead leaching in like the drinking water in those buildings, and that also that they're up to standard like with lead paint. That's pretty much it. Now on the air quality side, there's a whole lot of stuff that you could do with that, but we're kind of stuck about like what we can do like with this body like on the air quality side. We need like a full community day to think like out like how to do this, because essentially when I did, because it literally was almost a year from today when I presented to county commission, they don't know. They really pretty much was kind of like, what you want to do, tell me what you want to do, and then we'll try to make it happen. That's what happened with this commission. It was like, tell me what you want and then we'll see what we can do and make it happen. I think that probably would be the most advantageous, but I ain't got no answer today. I don't know.
Question. So, what would be I guess, like reasonable goal or expectation for a community to just in terms of like community liaison and so like would it be increased screening, increased testing, screening awareness, and if that's a goal, so if the number currently is, let's just say it's 13,000 out of 73,000 children under 6 have been screened, is there some interest in around organizing, like just through community organizing, getting maybe 26, 30,000, screened, and just coming up with a system of way where we can measure that. I mean, because I can just think about, just off the top of my head, I know at least like 5 to 10 of the absolutely most atrocious low income housing areas in Memphis. Like I can take you straight to, I mean, it's on literally right around the corner from me, right? Like, and then that's not even including like room and houses, things like that, which I feel like could and should be covered by the health department. But I don't think that they are. Like, I don't, you know what I'm saying?
That's a good point. That is probably a huge gray area.
Yeah, big time.
Yeah, and I wonder about like, there's like the 57 kids that are like 20 above. It's
Yeah.
like, where are they? Is that like a concentrated spot?
Right.
Like, could there be a specific canvassing effort around where these like super heavy burdened areas are to like hone in? Is like that is
Like hot spots.
that is like
Yeah.
57. That is crazy amount of lead.
Yeah, that made me want to cry looking at that.
It is, but it's also the question becomes is what's the deeper level? And I'm sorry to get off on a tangent, but deeper level data tracking. Because
Yeah.
those 57, because what we know in our community is, those communities probably where folks are most likely to have lead poisoning, they're probably moving 3 to 5 times a year.
Oh,
Right.
transient.
Yeah, so
Dang.
so
I didn't even think
how
about
we tracking
that.
the data? Are 30 of those kids coming from the same area and they move across the city in different places? So now they're dispersed in different places. How are we tracking?
And they don't even, so I know in DC, they have, it goes back to capacity. One nurse, so they got one nurse and they got one like regional manager, which is Dr. Barnes. So that means they don't have a data. She's the data entry person. She's the grant writer. She's the project manager. The girl's doing everything. So it's just her and like a nurse. I didn't even know it was one nurse. But in DC, they have a whole department that's literally like data. That's what they do. So they do these community stakeholder engagement meetings once a month, and they report out around like their like testing rates. So they have this like robust, like it's probably, what's the name of that thing? What's the name of that? It's real fancy. It's this database that people use all the time. I forgot what the name of it is. Anyway, it has like a lot of like infographics and stuff that helps you to like visual. It's a visualization tool, but I can't think of it now. It's not GIS, but it's similar. Anyway, that's not. I'm being a nerd right now. But anyway, essentially with this data, every month it tells you like this is the amount of kids that we should have been testing at this point, and they do it by ward. In this case it would be like by district because we don't have wards, and it fluctuates like you mentioned, but at least they have a basis of like to keep them like on task. Like this is the baseline for this month around like who we were supposed to test. Based on that baseline, this is the percentage of kids that we tested. Then based on the percentage of kids that we tested, this is the percentage that came back with elevated levels. Because what they're showing us is like a bit more aggregate, and it's not showing like some of the nuance like with like how that data works. But then going back to capacity, like somebody literally and I praise them for that, somebody had to assemble this presentation for today because they don't have the capacity to do that level of analysis. Now, one thing that I know is a collective of people, like when Chet mentioned, there's a collective of nonprofit organizations that are literally trying to work adjacent with the health department. You literally can have a nonprofit organization who could do that work for you. If you do it that way, you won't get caught up in red tape. So for example, for Director Taylor to do this presentation today, it had to go, I know, through all of these different like channels of like approval and like assessment. I used to work for the government. Like you think that it's simple. A 4-page PowerPoint it has to go through legal, like all of these things, where if it's like an adjacent organization, they're not subject to the same level of scrutiny. But those resources like kind of don't exist either. So when we talk about even like with Biden invested in like lead service line replacement, I'm gonna be honest, there is not enough investment, if at all, on the public health side. So once you do all of these like lead service line inventories, we already know where they're at. In Memphis, we know where they're at. What's gonna happen with where's the money on the public health side? So once you figure out where all the things are, you know that people have been poisoned. Then what? So now if you do this community outreach and you say like, hey man, it's lead in your house, folks could be like, well, damn, you know, like what I'm supposed to do with that. So even like in that interview, it's not funny, but when they did the announcement and I did that interview, and she asked me where was the lead at, and I said go to Orange Mound, for example. And the man that she talked to was just like, what? It's lead in my house? He was like, it's lead in my dad's house. It's like the house that and it's like, what's the point of recourse after that? And that's the gap is right there. And it's like it's really complex. But going back to that city council meeting, or the committee meeting where Michael was just like, y'all gotta access. So like and I'm just gonna be real, if there is a need, I need for the health department to say, to go on record, I got one nurse and one manager. Y'all need to give us some more money. We'll do it for you too. I have no problem. We've asked before, that they're so underfunded, and it's not money that's coming from federal. It's not money coming from the state. It's absolutely nothing coming from local. Honestly, at that time, a commissioner said that when we asked just straight up for that money, this person is no longer a commissioner, and it was like, it needs to show up in the county budget. But I'm like, you approve the budget. If you see discrepancies and disparities in the line item, it behooves you as the county commissioner to inquire, right? So that the onus wouldn't just be on the health department, it would be on you too, but you looking at what you want to look at. Anyway, So maybe
One of
like,
the things that you made too, I think like thinking about who are these kids each of these years? Is the same kid ever getting tested twice in a row to see like kind of follow? Right, and like that's kind of I'm curious if this is like, the same kids over and over and we're not getting an additional footprint of like who else might have exposure.
Right, like,
mhm.
so many questions occur, like, what's the process? What, like, is it every, like, and knowing that there's not all the 6-year-olds, right? It's not every 6-year-old.
Right.
So what's the criteria for the 6-year-olds that are tested?
Mhm.
So you're taking a sample size?
Yeah, it was a little bit unclear. I wasn't gonna say nothing. I just let it get through it. Cause I used to be like a whole data and accountability person for like the district. It used to be my whole job, so I wasn't gonna go down that rabbit hole.
Yeah.
But at least we saw, something that was
Well, you can
gave
even
us some
see here,
sort
like,
of
the year
foundation.
that had the highest testing, 2016, it had the highest levels of lead.
And it was
in
a
the body.
lot
So
of
it's
stuff
like,
in the
more kids you
news in
test, the higher the lead
2016.
level. Like there's a problem is bigger. We just don't have enough people to actually test.
So it sounds like I would glean from that is we have a marketing issue.
Yeah, and so and like we need for people to be like more comfortable like with everybody saying something. So it took us 2 years to get Shelby County Schools to put the lead testing information in a parent, 2 years to put the information in a student in the parent newsletter. 2 years to get it in there because it's the fear, right? So it's the fear that they have, like they still are reliving the trauma from 2019, and it's the fear that if they put that in there, then parents may be like, "What? Like I need to get my kids lead tested? Like why? Like is this something happening in school?" And I'm like, I don't think that that's how parents are gonna respond. I'm like, just try it.
The question is, does it matter how they respond? The question
Right.
is,
I want you to be
the
shook.
question
Shit.
is,
I mean,
are we
curse that.
prepared to do something about the lead that's found? It doesn't matter.
Because you don't know where the source is. That's what I kept telling them. I'm like, even like on the lead paint side, we need to mitigate and reduce lead everywhere, not just in paint, but in water. It could be in consumer product. It could be a myriad of ways. It could be in soil. It can be, it could come from a lot of different places. It could be in the air with all this development that's happening. The source, like to me, is not, it doesn't negate, like you just need to know what's going on with the child and then like figure that part out later. Like figure out if the child has elevated levels. If you do, then you need to do your due diligence to see where is the lead exposure. Not like what has the most lead exposure. I don't care. Mitigate where the lead is altogether. Like it's like an oppression Olympics thing that's happening. So MLGW, like the most likely way is through lead paint. We know that, but you also can get it through water too. You can drink some water with some lead in it one time and your life could be changed. So it really doesn't matter. But
So the 6 age thing, is that a federal law or is that the state law? Federal.
it's both. So
Some of us are like,
I hate it.
12-year-olds.
It's like that across the board. So that's like that on the hoods. It's like that with hood.
Yeah.
I hate that. So that's why they're kind of stuck. Now the only time is when Mayor Harris, now you can have local control.
Right.
So when those results came back in 2019, Mayor Harris was like, I don't care, figure it out, test all the kids. I don't care if you figure it out. But then like, right, then, they had, I think, because that was before COVID, I think they had 3 nurses at that point and they were going through it. But so maybe a next like step on that one, and it may not be just within this body, maybe like community-based organizations can do like, we need like some type of like think tank, like we got to collaborate to figure out like exactly like what this would look like, so that if we do go in front of these respective bodies, because the majority of the stuff lives on the city side, so that we can like have a very specific ask around pollution reduction. And I'm gonna add another part, it has to be tied to public health outcomes. So not just doing stuff just to do it and just be like, We got some air monitors. I don't care about that. Did the childhood asthma rate go down or not? Like, I don't care about that. Like, if it's not, like, the bottom line is like, are children still alive? Are our elders still alive? Are people still living? Is their quality of life improving? Is the bottom line. And I don't think like that is like what people are looking at. They're looking at other stuff. Like, that's very transactional. But okay, well, that was a heavy one to start with old business. Okay.
Sorry.
Well, one thing, if you know, if that kind of collaborative approach came through, there's the EPA's toxic release inventory, which is a really good, it's industry data source, but it's like, Valero has to report how much, how many pounds of toxic crap that they dump into the air. So there's like databases that have air, water, land, and like waste management, and it's like the actual toxins tracked.
Right.
So that could be a way to kind of pull in folks like, hey, we know you live by, the northern little industrial section on like Watkins area, like come out. Toxic release inventories.
You just explained that so much clearer than EPA ever has. When I tell you I have never understood, when people talk to me about that a lot, and I'm like,
it's really like, it is like the amount of information
Wow.
on here is so incredible, and it's like no one knows about it because it's like, of course, not easy to use at all. But you can look at, so just looking at like a map in Memphis. So this is, where did we go? See, and now I'm already screwing up. It's only giving me one dot. But like, so there's Valero, for instance. So you can like click on, in theory, anyway. Nope, maybe.
come on.
It's clunky. But so you can like look at these different, let me do it, let's refresh and get that same back up in action. But I think it would be a good kind of starting point for what kind of like, pollution reduction we're really talking about, and like what chemicals are we talking about. And, it kind of gives you the name of the chemicals, the pounds released a year, and some of it's like accidental, and some of it's just like the process, like how it works. So
Then how many accidents they got? Because you got me messed up. Because how many,
I know.
because you need to
Okay,
get
well,
it together.
now that I'm trying to show it off.
Thank you for showing me that, because I always look at the EPA, the EJ screen tool is where I live, but that's another good source of data. It's another database that they just released that's like health from EPA. I can follow up on social. I think it's on our social media page, this new tool that they created that's like very like health intensive, but I know it's past time.
I was just thinking about, I don't think I follow.
I don't know.
You don't have an Instagram, do you?
We do. We got a Facebook, Instagram, and Twitter. I'm always calling it Twitter. I don't care. I'm not calling this thing nothing else. Okay. We can go to the next item. I'm gonna try to go through these things kind of quickly. So at least this is good. We got 14 more minutes. Got 14 more minutes. Okay. All right. So lead poison prevention week. I'm gonna be honest. I didn't do it as big as we did before. It was just a rough time. I'm so sorry. We did get the mayor's office. They did some retweets, so that was great. Also, the TDEC follows us now. Yay! So that was exciting. So that's just the win there. I'm so sorry. I tried to do the best that I could. We could do better next year. Just sneaks up on us every time.
What time of the year is it?
It's the last full week in October.
Okay.
Then, like, I feel like even with CDC and EPA, I feel like they were dry as well this year, like with their postings. Because I was hoping that I could just like repost something. It was a little dry. We were going through.
Last year was a bit more robust.
You know what? I know what it was. Wasn't that around the time where they were either like they had just said that it wasn't going to be a government shutdown, or I think it was kind of stuck like in that window of time. Yeah, because it was,
Like here, it can show you, like, you can put in city, zip code, whatever, and it'll show you like the releases by volume, and you can see like what they're actually, you know, putting out into the air, into the water. It's a pain in the butt to work with, but there's ways to kind of get into the nitty gritty of like what are they pumping out, and that can be a pollution reduction like strategy thing.
And I think like what we may be able to do, I had a really bad experience before city council when I tried to explain the EJ screen tool to them, specifically with the super districts. So first of all, the super districts are racist. But essentially what they weren't understanding what I was saying was, if I am in, so I'll use JB Smiley's district, for example. If I put in like his address of where he lives within his district, like, and so now technically I'm in his district now. If you put in where I live on, you know, downtown, it's gonna look drastically different from like where he is versus where I am, even within the same district. And so what I was trying to articulate to them is the disparities when you do clump everybody together in these super districts, gerrymandering. But essentially, I think from a strategy perspective, I would really like to do like one-offs, like with some of these like folks that are really like a Michael. And kudos to Councilwoman Easter Thomas, you know, that would be a bit more inclined to see something like that, as opposed to saying something to all of them all together, because they're gonna go left. It's technical, they don't understand it, and it gives too much room for them to just shut you down. Yeah, but I like that, and now I understand what this meant. So for years I didn't understand the words that people were saying to me. Okay, so update on progress with lead service line replacement. We gotta win. Woo! It took all this time. We gotta win. They don't have a plan though. But we have been asking for a long time, and it's on the record that they absolutely do not have a plan. What they presented, I don't know what that was. We do have an advocate on the city side that was very clear, with Councilwoman Easter Thomas, where essentially she was just like to her colleagues, like, we got to do something about this. And my favorite quote was, if we can put $200,000 into $200 million into a stadium, we should be able to replace these lead pipes. It was a mic drop. And also with this approved budget, that they did not have a line item for line service line replacement, but you said that is a priority. It's not, it didn't show up in the budget at all, and the city council approved it anyway. I think that will absolutely change for fiscal year 2025, because it's absolutely on people's radar, which makes it even more important for this community informed advisory, so that you don't ever do that again. Also, it showed up in that committee meeting. I have been personally asking since 2017, can you do a cost analysis of how much it's going to cost to replace all lead service lines? They got caught up in that meeting, and they didn't have a number. Michael also said, excuse me, Councilwoman Easter Thomas said, the number that you've given me has changed at least twice, because they don't have a plan. They haven't done an analysis. So a win is a win. At least it's gone on record that like we have to get it together. It's helpful that we got like the teeth from the feds at this point also, and they got a deadline, and they can't say that at least a preliminary start is money, because you got money, you got some money, you got more money than what you've ever had before externally, but city council is gonna have to match it, because it's not enough federal or state money, right? But I don't have any more. I do have some updates. I'm gonna keep pushing MLGW. I'm gonna use my capacity outside of this commission, just because it's on the county side, and I don't want that to be used as right, where you just shut me down and say that I'm coming from the county. So I will be representative of myself as a ratepayer, as a customer, with any additional interfacings that I will have with MLGW. On the record, I'm going to their board meeting next week, and I'm going to be consistent and keep asking for this advisory. It is on the 20th
20th.
at 8:30
Yep.
at the downtown, the
Big HQ.
yeah, there we go.
On North Main.
8:30 in the morning.
Very accessible, of course.
So yes, we can get as many people to talk about that. There's also in community a petition that people can sign to show solidarity specifically around this community advisory as well. And there's some other recommendations on that petition as well. Okay, let me hurry up. Dang, this was Sharon again about these rules. And with agenda item D, the barriers with the rules for lead paint programs, we're gonna have to table it again because I don't want to misspeak. Okay, next item, update on Memphis Shelby County Schools and the municipalities with the lead and school drinking water testing. They completed testing during fall break. In the on the website, it was a bit vague. Essentially, it summarized that essentially like the policy is working where the numbers are going down, which is great, but it doesn't give any specificity. So they named that there were some schools that had some sources that still had elevated levels. They didn't say like what those schools were. They didn't say what the rates were or what the levels were, but technically they don't have to based on the law. Now, we would love for them to be more transparent. They can do it. So this is the thing that bothers me with local government. You can always do more. You just can't do less. You don't have to do the bare minimum. I think this is an interesting time where you have an interim superintendent. I think that this is the time now, to just, why not? She ain't got nothing to lose, and she apparently can't put a bid in anymore for that seat. But the school board needs to amend that policy. Like, I don't really care how you feel like about what the rest of the state is. We heard from our director from the health department today. All this lead is here.
That's the argument, though. It doesn't matter about what. Of course, yes, it matters what state, but that's a different locality.
Exactly.
We have very specific and different issues that are primarily surrounded around economics, and we know with economics comes diminished economics comes more problems, right? So we can't base it on what happens in Middle Tennessee, East Tennessee, because we have specific challenges and problems here. So I don't want to hear about what the state does.
Correct. So we have reached out to SCS. This must have been like maybe 2018, I think, where we had some recommendations for them to, because in 2018 is when they had to draft the policy because the law went into effect in 2019. And so we had let me not say we, community organizations came together and hosted like a community session. It was at a school where we had like school personnel there to say, we had parents there to say, what are our recommendations? They didn't move on that at all with that particular like composition of school board members. Technically we have an ally in Frank, but I'm just, as a human, I just want to look out for him and his health. But we do need an amendment. We need an amendment to that policy. And you're right, Eric, like I don't care what they're doing in Nashville. They don't have anything to do with us. We have a crisis here. And that policy is weak. It could be stronger. The other thing, like in summary, with testing this year, even though like right now, like all water sources are in compliance, it's still based on this like law that like it's between 15 to 20 parts per billion. That's still really high. So yes, you're in compliance based on the law. So one of the recommendations to the school board was to lower the threshold of remediation at least to 10. Really, I want it to be 5, but at least to 10. They didn't act on it. It's a possibility that they have some lobbyists to also block that bill that was carried by former State Senator Lamar. So Yeah. Also, like from a federal perspective, the lead and copper rule, like the public comment is open. Written comment closes on February the 5th. You can sign up for the public hearing where you can make verbal comment. The last day to sign up, I believe, is on January the 9th. Right now with the, oh, go ahead.
I'm gonna say, is there information available somewhere?
Yeah, if you go to, I think if you go to the LPC social media, or if you go to Black Millennials for Flint, it's on there. Also, like on our website and on like Facebook, IG, and Twitter. With the lead and copper rule, it's still not addressing lead in school drinking water the way that they should. It's still not giving it teeth. So that could also be like a push. If you can get if you could get the EPA to tighten up their grip on it, then it will automatically impact like what you can do with the state legislature, because then you can get like our reps to say, hey, this is just be in alignment with what we got to do anyway with EPA, so that our legislation can be in alignment with what exists like with the feds. But right now, I think like from a state legislator perspective, they're nervous that if we keep messing with this thing, that the GOP will be like, actually, you know what? We're not doing this at all no more anyway. So it's a slippery slope. Fix it, Jesus. That's my updates there. I think
So, just to clarify, the amendment you would be looking for, specifically on line item E, would be to lower that threshold.
To lower the threshold and to provide more public transparency. So like when there are sources that are above that threshold, list the schools.
Right.
Actually, no, list every single school in the district and tell us what it is.
Right.
So for example, like I'm gonna keep using DC as an example.
Yeah.
So DC just lists out all the schools. They list all the schools, even if it's above or below. It's very transparent about across the board. Right. So have something like that. They were very resistant. I know in 2019, honestly, nobody pushed back on them after that, but I think that it needs to be resurrected. It was parents that literally were begging. There were parents that did FOIA requests. They did not honor those FOIA requests.
How do you not honor a FOIA?
There's not a time limit on FOIA requests.
Yeah, I get a bunch of them in
I did not know there was a time limit on FOIA.
Yeah.
I guess I intuitively didn't recognize.
Yeah, well, I thought it was the 7 day, at least you have to get a response that I'm still working on it 7 days. Or is the count I'm very.
Now, if somebody files a lawsuit and then your records get subpoenaed, then that's different. Yep, so that's the update on that one. So I think like community groups, should they be interested, should come together again, should they want to have community-based recommendations for MSCS. And also if you want to push from a state legislator perspective, but I think you could have a local win as opposed to trying to work through the state. That's just my opinion. I'm afraid if we got some interesting energy that's going on with Shelby and the state legislature, I don't want any smoke. Okay, next update, this resolution around EJ. So tentatively, there's going to be a RFP that should be released either in January or February. Ooh, this has been a long time coming for this, my God. But to give some context, so this $160,000 is from ARPA funding. There was a resolution that was introduced by former Commissioner Tammy Sawyer that called for the administration to allocate $160,000 that had to go towards environmental justice. We know that that's very broad, but what the administration has decided to do is to earmark that towards lead poison prevention. So essentially, what we foreshadow how it will look is it makes it like accessible to like small, like community-based organizations like moderate size like community organizations and maybe larger ones, which is great. So then like going to like what our brother here talked about, like having people that are like very much so like on the ground, like being able to have access to those resources. So we just kind of are looking out for when that would be released, but that's a win that, you know, that is around lead. It's been years. Next week, quick update, new and appointed LPC members. Eric, did you do your application?
I'm just gonna slow blend.
Okay. So we have some folks that are current members that are up for reappointment. We also have two applications that that have been submitted. So we have Doravia. I was gonna say Doravia Freeman. That's her maiden's name. Her maiden name, Rich. Sorry. Never mind. We went to high school together. My bad. I took it back way back in time. So we have Doravia Rich from Black Seed. That has been submitted, and also Sarah Houston from Protect Our Aquifer as well. And so essentially, what the protocol that they try to follow is to try to group everybody together so that it could just be one agenda item to go before county commission. So that would be for reappointments and for whoever the mayor moves forward to present before county commission for a vote. I'll probably just touch base again with his team in January. It's over with at this point. I'm gonna leave everybody alone to see where they are with that, because we do need to get these vacancies filled, and I don't want to lapse too far, like with the people that need to come back on. Yep. All right. Let me try to hurry up. We might have to table it. Yep, because it's 7:49. Okay, so we only made it through old business. One thing that we do need to do, so and we can't vote, so I'm just gonna have to just say we gotta do. So a new business, I recommend, but we can't vote, that we table items under new business A, B, C, E. We do need to, and we're gonna have to probably do this. We're gonna have to do this virtually. Dang. We need to propose the meeting dates for 2024. We still need to come up with something right now, and then we can just follow up virtually. We're gonna get up. We gotta get up. We good. Like two more minutes. 2 more minutes. Okay. All right. So let's just let's do it virtually. Do we still want to do like bi-monthly still at least?
Yeah.
Okay, so we'll go with bi-monthly. A Wednesday, or we want to choose another day?
Every day is gonna be slammed. So
Okay. Okay, because right now we're doing we're doing the third Thursday. This is the third Thursday, right? Or is the second? I mean, shoot, Wednesday. Is this the third Wednesday?
That's the second Wednesday.
It's the second Wednesday, so we're doing the second. Shoot, I don't know. We're gonna do Wednesday. Thank you. Wednesday every other month. We'll do it offline. All right. We're gonna also table announcements A, B, and C. All right. So I call this meeting to a close for the Shelby County Lead Prevention and Sustainability Commission at 7:51 p.m. As we do not have quorum, I don't need a second. All right. Thank you.